So if we remove the organs, the kidneys, the spleen, the pancreas, the suprarenal glands, if we remove all the organs within the abdomen and all the arteries and their branches, and we're just left with the muscles, we can see a whole series of beautiful nerves which are radiating away from the spinal cord through the intervertebral foramen. And we have a number of these somatic nerves, and these contain sensory and motor fibers that supply the skeletal musculature and the skin of the abdomen. So these are containing sensory fibers that are taking cutaneous information back from the skin, and also motor fibers that make the muscles contract. As it's somatic nerve that's passing to the body wall, there's also going to be some sympathetic fibers that control the hairs, that control the sweat glands, but we don't have any parasympathetic input. These nerves that are running down the posterior abdominal wall, and we can see a few here. We've got the subcostal nerve. This is T12. That's the last nerve to originate from the thoracic segment of the spinal cord. Then we have iliohypogastric and ilioinguinal. These are both derived from the L1 spinal cord segment, iliohypogastric and ilioinguinal. We can then see we have the genitofemoral nerve. The genitofemoral nerve is passing out through psoas major here. And the genitofemoral nerve splits into a genital branch and into a femoral branch. And these two nerves pass through psoas major. One then runs along the inguinal canal, runs within the spermatic cord of the inguinal canal to supply the skin around the scrotum, around the labia if it's in the female, and the femoral branch passes through the fascia of the thigh to supply a discrete region on the anterior surface of the thigh. The genitofemoral nerves come from L1 and L2. We also have the lateral cutaneous nerve of the thigh, which we can see radiating down here. We can have the obturator nerve. The obturator nerve is really important, coming from L2, L3, L4, and that supplies the adductor portion of the musculature in the lower limb, the adductor or the medial portion. It leaves the pelvis by passing through the obturator foramen and the obturator canal, which is a defect in obturator fascia. So it runs along the lateral wall of the pelvis, and we can pick up obturator nerve coming down in this direction and see it passing through obturator canal. That's important, like I said, to supply the medial compartment. We also have the femoral nerve, L2, L3, L4 again. And the femoral nerve, which we can pick up here, is quite a large branch. It runs lateral to psoas major muscle, and it extends down into the anterior compartment of the thigh, where it goes on to supply the anterior musculature of the thigh, so rectus femoris and your quadriceps. We also have the lumbosacral trunk, which is from L4 to L5. So we can see we have a whole series of nerves radiating along the posterior abdominal wall, which are really important in maintaining the function of the muscles within the posterior abdominal wall and elsewhere, and carry important sympathetic fibers to the body wall as well. They're also going to be containing cutaneous information via the sensory fibers, taking information about pain, touch, temperature back to the central nervous system.